Hi, it's Patrick Hutzel from Intensive Care at Home, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies by improving their quality of life, and where we also provide tailor-made solutions to hospitals and intensive care units to save money and resources whilst providing quality care. In the last blog, I answered a question from one of our readers of our blog, and the question last week was, is it appropriate to discharge ventilated patients from ICU or pediatric ICU to home? You can check out last week's episode by clicking on the link below this video. In this week's blog, I want to look at the bigger picture when it comes to intensive home care versus hospital care and look at some of the issues that prevent more people going home from intensive care rather than being stuck in intensive care and in hospitals. So today's blog is about home before hospital. Does it need to be legislated as a right for patients and for families? So one of the biggest issues preventing more and more patients from receiving care and treatment at home instead of receiving care and treatment in a hospital or in intensive care whenever appropriate is that it's not a right for patients and their families yet. So why is this important? So in spite of overcrowded public and private hospitals, and in spite of overcrowded emergency departments and emergency rooms and overcrowded intensive care units, current legislation is not helping the status quo, and current legislation is not helping an already stretched system and their most important people, the patients and their families. So where to from here, and what have other countries learned to effectively manage ongoing high demand for hospital and intensive care beds in particular? So take, for example, Germany, the first country worldwide that embraced intensive care at home services on a large scale since the late 1990s. So one of the main driving forces to empty hospital and intensive care beds was to realize that hospital and intensive care is financially not sustainable in the long term, and also that patients and families didn't want to be there. And of course they didn't. I mean, imagine you're stuck in intensive care for months or for weeks on end. And if there is another better alternative, especially when it comes to going home, it's a no-brainer. So therefore, quality of life and quality of end of life can only be achieved at home and not in a hospital or in intensive care, period. It makes perfect sense. Furthermore, the economic realities of being able to slash the cost of an intensive care bed by 50% in an intensive home care environment whilst achieving similar or better outcomes is something that cannot be ignored. In Germany and in other European countries, in order to provide this win-win situation and solution where all stakeholders benefit, the government was supporting this massive shift to hospital in the home and intensive care at home by legislating patients' and families' rights to have a choice. So similar legislations also need to be supported by governments in Australia, in the UK and in America, because it creates a win-win situation. It helps managing limited and stretched resources in intensive care, and it helps long-term ventilated patients and their families getting what they want, need, and deserve. The cost savings are in the hundreds of millions, if not billions of dollars every year. Look at patient and family satisfaction also. Whenever long-term ventilated patients with tracheostomies can leave intensive care, patients and their families can return back to some sort of normality rather than spending day and night in intensive care. By having intensive care services and intensive care nurses coming into the home 24 hours a day, it creates a genuine alternative to a long-term stay in intensive care. State and federal governments need to recognize this massive opportunity, and they need to start embracing the benefits that intensive care at home creates for all stakeholders. And home before hospital needs to be legislated, therefore, as a right for patients and their families. Thank you for watching today. If you want to find out how we can help you to get your loved one out of intensive care, including palliative care or long-term acute care, or also out of a nursing home, or if you find that you have insufficient support for your loved one at home on a ventilator, if you want to know how to get funding for our service, or if you have any questions, please call us on one of the numbers on the top of the website, or send me an email to patrick@intensivecareathome.com. That's Patrick, P-A-T-R-I-K, @intensivecareathome.com. Also, have a look at our career section if you are an amazing and enthusiastic intensive care or pediatric intensive care nurse. We are currently hiring for clients in the Melbourne metropolitan area, northern suburbs, Mornington Peninsula, and in South Gippsland, Victoria. We are an NDIS, TAC, and DVA approved community service provider in Australia. Also, have a look at our range of full service provisions on our services section. And we have also been part of the Royal Melbourne Health Accelerator program for innovative healthcare companies. Thank you for tuning into this week's blog. This is Patrick Hutzel from Intensive Care at Home, and I'll see you again next week in another update.